By the beginning of March, COVID-19 had claimed its first victim. Hospitals were discharging patients to free up beds, but many were transferred to care homes, but only those with symptoms were tested. A lockdown was introduced on the 23rd, but hospitals continued to send patients to care homes and only tested those with symptoms. And on the 16th of April, government advice changed, requiring all patients to be tested before being discharged to a care home. By then, Addenbrooke's had sent 116 untested to homes. Freeing up hospital beds was a priority when coronavirus cases began to increase, but a leading charity for older people says steps have been made to reduce the spread.
I do believe that the care homes did get forgotten, but thankfully the testing is now in place, as is the support from local government to absolutely ensure that the homes have the correct PPE and the correct support and the correct capacity in terms of staffing, which they are providing when it's needed.
In a statement, the government say this is an unprecedented global outbreak and we have taken decisions based on the latest scientific advice. They also say we've been working tirelessly with the care sector to save lives, and as a result, over 60% of homes have had no outbreak at all. As we struggle to understand how the virus got into care homes, the fact that so many untested patients were sent there from under-pressure hospitals is becoming an increasingly difficult question for the government.
And Theo is with me now. And Theo, Addenbrooke's isn't the only hospital that sent untested patients to care homes, is it?
Well, no, Addenbrooke's is the biggest hospital in our region, but when they made that decision to move patients from hospitals to care homes, they were adhering to national policy. So it's likely all of our hospitals discharged untested patients in those early days of the lockdown. How many? Well, probably not as many as Addenbrooke's, but certainly significant numbers. Addenbrooke's did respond to a Freedom of Information request quickly, and that's why we have patient numbers for them and not our other hospitals. But as I mentioned in my report, they say they were following government guidelines at the time. Mo.